This afternoon, 10 on Your Side brings you a special coronavirus digital discussion about the pandemic. We have these on most Monday afternoons at 1:15, and today we are talking specifically about vaccines. We have 3 of them approved for use now, but are they all created equally? Joining us is Dr. Edward Oldfield, infectious disease expert with Eastern Virginia Medical School. Dr. Oldfield, thank you so much for taking time out of your busy schedule to answer our questions today.
Thank you.
So let's talk about the Johnson & Johnson vaccine, just approved over the weekend for emergency use. It's expected to ship out 4 million doses this week. They've already started doing that. What will this mean as far as the speed of getting people vaccinated and possibly reaching that herd immunity level?
Yeah, so this is very exciting, having a third vaccine available, really just extraordinary, and another very effective vaccine. We're going to get probably 50,000 doses in Virginia just this week. The important thing about this vaccine is it's a single dose. So you don't have all the problems with tracking that first dose and the second dose. It also only requires refrigeration. So this will be particularly important for rural areas, for hard to reach populations, where you can send people out, give them that one dose, and they're done. And you don't have to worry about the freezing and all the other issues with Pfizer and Moderna. So this is a real advance.
So it does sound like a great thing, but some of our viewers have mentioned some concerns that this one-shot dose, which, as you mentioned, sounds good, they're concerned it's not as effective as the Pfizer and the Moderna 2-shot series. Can you address that?
Yeah, so it's important to understand that the Pfizer and Moderna were studied in a different time. They were studied before these new variants like the UK and the South African strain. This Johnson & Johnson vaccine was studied much more recently. It was studied in South Africa, the United Kingdom, US, and South America. So you really cannot compare the numbers head to head. The bottom line is that the Johnson & Johnson is probably 75% effective in the United States in preventing symptomatic disease versus the 95% quoted for Pfizer and Moderna. But it's 85% effective against severe disease. And importantly, 28 days after that single dose, no one in any of the studies in any of the countries was hospitalized or died. It was 100% effective against somebody getting hospitalized after 28 days. So that's really exciting. And I think the important message is that take what you can get. They're all 3 of them are superb vaccines. There's really no difference in side effects. The severe allergic reactions, only 1 was reported with the Johnson & Johnson vaccine. More were reported with the Moderna and Pfizer, but it still works out to only about 3 or 4 severe allergic reactions per million doses.
Wow. You made an important point at this time when there seems to be so many more people wanting a vaccine than we have available, is that you take the vaccine that you can get. But there are some people who will do their own research and for whatever reason will decide, I'd rather have this one. Do you think that that is even a possibility, or is there anyone out there based on medical conditions or allergies who should be looking to get one versus the other?
Yeah, I would say with what we know now, if you have an opportunity, take that opportunity with the vaccine that you're provided with. It would be a real shame if you decided, well, for a few percentage points, I'm going to wait, and then you don't get the vaccine, or something happens between the first of the 2 doses with the Pfizer and Moderna, where you would have been done with the Johnson & Johnson vaccine with the 1 dose. And by the time you were getting your second dose of the other 2 vaccines, you would be 100% protected for hospitalization or the chance of dying.
And that really was the key when we started all of this, wasn't it? Was we were trying to bring down that hospitalization rate. Never did we think that we were going to wipe out the coronavirus. We wanted to make sure that we could care for those who were ill.
Exactly. And the very first group that was vaccinated was people living in long-term care facilities, nursing homes, and the staff. We vaccinated 4.5 million. When we started mid-December, there were 33,000 new cases in nursing homes every single week. By the end of February, it had dropped to 3,500. There were 5,000 people dying in nursing homes every week. In mid-December, when we started, that is now down to 1,500. So already we're seeing a really profound impact in people that are vaccinated. And I think the next thing we'll be seeing is the same sort of information related to those over 65 and those with what we call comorbidities, diabetes, obesity, hypertension, and we'll see the same decrease in cases and severe disease.
Well, that really is a big difference there. And speaking of the numbers, I want to go back to that idea of herd immunity. And it's something we've all heard about, which means that we might be able to take off the masks or have more people at our social gatherings. At what point might we reach that herd immunity? I've heard different numbers floating around out there about what that means specifically for coronavirus.
Yeah, most of the data I've seen suggests probably 70 to 80% of the population to either be vaccinated or to previously been infected. But when you get one of these more infectious strains like the UK strain, that number actually goes up because it's more infectious. You need more people vaccinated to get the herd immunity. What I'm looking at more than herd immunity is just the decrease in cases, the decreases in severe disease. And so we can really get a handle on this virus. And I think what we're going to see next is people that are vaccinated and can prove it. Those are the people that are going to be able to go to sporting events, to go out to dine inside. So it's really going to be important to get vaccinated and have proof of that. It'll be international travel. I'm sure you'll have to prove that you've been vaccinated. So hopefully that will spur more people that were sitting on the fence to go ahead and get vaccinated.
Yeah, let's talk about that. So there are some people, while we do still have more people wanting the vaccine out there than we have doses for, we know there are some people out there who have declined to receive the vaccine, and that goes for hospital workers, frontline workers. Do you have any idea what those numbers look like and whether there's been any change with more people getting vaccinated in a longer period of time, perhaps?
Yeah, so, unfortunately, in the African American population, they have suffered between 2 and 3 times higher deaths than in the white population. And for those in the 35 to 45-year-old group, they've suffered deaths 9 times higher than the white population. Wow. Yet it's the African Americans that have more concern about getting the vaccine and have more vaccine hesitancy, and they're the ones that need it the most. So I would highly recommend that we get out into the African American community, get with the churches, the barbershops, get people respected in the community to really push getting the Black population vaccinated. Critically important.
You mentioned that age grouping there. What did you say, 35 to 50 range where it's a little higher? Which is that due
35,
to? Go ahead.
35 to 45.
35 to 45. Yeah. And is that due to more comorbidities, do you think, in that population?
Yeah, and it may just be mistrust and distrust of the healthcare system, so they may come later to care, and they may be sicker. But the data is pretty clear that African Americans are at higher risk than the white and Hispanic population, and they are the ones that really need the vaccine the most.
Okay. Let's go and talk about those variants again for a moment. You mentioned that this newest vaccine, the Johnson & Johnson, was tested and may work better on some of these variants. So let's say I've already been vaccinated with Pfizer or Moderna. What is on the horizon for me? Is there another booster shot possibly? Do you see this long-term being something like the annual flu shot that we get?
Yeah, so it turns out that both Pfizer and Moderna vaccine work against all the strains that we've seen so far, the South African, the UK, the new California strain, Moderna and Pfizer still work against it. But they're not quite as powerful as they were against the basic strain. So what we're seeing now is a study starting actually this week on a third booster dose. Also, Moderna has already modified the messenger RNA to specifically protect against the South African variant. So already we're starting to see work on a third dose and a different vaccine specifically designed for these more difficult variants, and in particular the South African one.
What about a vaccine for children? Now, this newest one was not tested on children either, was it?
No, nobody's really tested under 16 for one and 18 years old for the other, but there is a trial going on in children right now. And there's no reason to think that the vaccine would have more side effects or be less effective in children. Fortunately, we have time to figure that out because children don't seem to have as bad outcomes as adults, but they can spread the virus. So it'll be nice when we get the information and then we can go ahead and vaccinate the children. But I think for right now, we really need to focus on the high-risk groups, those over 65, and those with what we call comorbidities, and really get that population done. So you can see that decrease in cases and hospitalizations that we've already seen in that first group that was vaccinated, long-term care facilities and nursing homes.
Mm-hmm. We heard the governor say last week that he hopes possibly by April that we can open up some more of these large outdoor venues and kind of get rid of that 1,000 person cap. Do you see us getting to that kind of a place by April now that we do have this third vaccine on board? Or do you think that, like we've seen in the past, it may take a little longer for one reason or the other?
Yeah, I would be very cautious at loosening restrictions. We've seen a significant decrease in cases since the first week in January, but now it seems to have plateaued and we're not seeing continuing decrease. And we're still at a relatively high level. We're at about the level we were at the peak in July and August, where the most cases in the state of Virginia were right here in Eastern. So I think this is the time to redouble our efforts, continue to mask, continue to do the 6 foot of social distancing. I think we're not out of the woods yet. And we have a little window here to get more people vaccinated, and we're doing a good job. We've had almost 2 million people in Virginia vaccinated so far. That's about 15% of the population. And we're doing a significant, about 35,000 vaccines a day. So we need to just keep forging ahead and develop our herd immunity, not from more infections, but from more people vaccinated.
Sure. And I hate to say this, but I know when you said we need to double down on our efforts, I could just hear the groans and see the people's eyes rolling. There, fatigue has set in. Enough is enough for a lot of people. They just want to know, where's the light at the end of this tunnel? So what is your best educated guess on when we might get to loosen up some more of these restrictions and get back to a little bit more of a normal life?
Yeah, I'm looking at May to June.
Okay.
To have most of the population vaccinated and maybe get to a little more normality, by late summer. I think that you're going to have to prove that you're vaccinated to really do international travel, to do a lot of things. So I think people are going to really, those that are hesitant now for the vaccine are going to really want it as we get further on. The United Kingdom and Israel actually now have a online certification for your vaccination. And that's required to do a lot of the things where they've loosened up restrictions. If you don't have it, you can't do it.
Yeah, I've seen those today, like a little vaccination passport that we might all have to start carrying around with us.
Yes.
All right. Well, 3 to 6 months. We heard it from you. Hopefully, we can hang on just a little bit longer, huh?
All right, yes. And you know, the virus doesn't care whether you're fatigued or not. In fact,
That's true.
it's going to take any opportunity that it has.
All right.
So let's just keep it at bay.
Dr. Oldfield, thank you so much for your time. As always, we appreciate it.
Okay, thank you.
And thank you all for watching. I'll have a recap of our digital conversation coming up later today on Wavy News 10, beginning at 4 o'clock. I'm Stephanie Harris. Have a great afternoon.